All right. Good afternoon. Sorry for the delay. We are really trying to get this set up that we have two of us live and we have our guests on live so you can see them on the video and just not quite working with Facebook yet. So we're still continuing to do that. Thank you for bearing with us, and thanks to my team for continuing to try to get that to happen. So it has been a really busy evening and morning. As we saw last night, the governor announced that we will be in the red phase until June 4th. So that is news that we will continue to try to break down for you and understand what that means for us here in Lackawanna County, here in Scranton, what that means for your businesses, your schools, your daycares, your hair salons, your dog groomers, all of those types of things. I know there are a lot of questions out there. We don't have all the answers. I know the governor's office doesn't have all the answers either. So they're working on it, but we need to hear from you to understand what your concerns and questions are. And then we can take that to the governor's office and ask them. So again, June 4th is now the stay-at-home order is extended through June 4th per the governor's order last night. That is tough news for a lot of reasons. We know that our numbers are still going up here in Lackawanna County, so it makes sense from a public health perspective, and gotta stay on board on that. However, I know that we have a lot of businesses out there who want to be open. We have a lot of folks who want to get back to work, get back to their daily lives, and it's tough. It's kind of a tough thing to see that we are under the stay-at-home order for another month. So I keep taking deep breaths. I know you are all taking deep breaths out there too. We got to stick to the program, stick to the plan. But as I said, let us know specific examples of what your questions are or what your small business or your household is enduring. And we can then use that example. We can take some of those really sharp examples to the governor's office and ask those questions for you so that we can better understand what this path looks like. So we announced yesterday a regional recovery task force with me and the City of Scranton, plus the state legislators, Senator Blake, of course, and the county commissioners. The city council here will be involved. The school board will be involved. The hospitals, medical experts, the medical college, infectious disease specialists. We've got on the economic front, the Chamber of Commerce, and a lot of different voices here to help us sort out what does it look like to continue to mitigate this crisis and from a medical perspective, from a testing and tracing. What are the best practices there? What are there things that we can do here locally that can supplement what the Department of Health is doing or help enable the Department of Health to be successful as we ramp up testing, ramp up tracing, and try to make sure that we don't see second and third waves of this virus. On the economic front, there's a range of businesses that we've already, of course, been engaged with. The banks we've been really engaged with to figure out if there are local relief efforts that we can put out there to supplement. Again, this is supplementing state things, supplementing federal things. Are there things that we can do on top of, for example, the PPP program and help the businesses out there, help our folks all get back to work, whether they're owners or employees? And it's really important that we be thinking about these things again with June 4th now out there. It feels like a long way away, but it will become before we know it. I think we need to look at this news, look at the positive that this gives us a little more certainty. It allows us to plan from a city perspective for you and your households. It gives you an ability to try to plan out and maybe plan for June. And there's no guarantee that June 4th will be the end of this, but it gives us a little bit more certainty. So I think we can look at it in that way and really try to see the positive, utilize these coming weeks to really get a handle on how we will reopen. So the task force that we're doing at the regional level will help that. And I'm very excited to be joined today by Terry Ohms from the Institute for Public Policy. She is a star in our region. We are so lucky to have her. Terry spends her days crunching data to help us make sense of our economy, our public health responses, the demographics in our area, and help us put together the pieces of where we've been as a region and where we are going. So today I wanted to bring Terry on for a few different reasons. She can really speak to just about any question you've ever probably had about the economy and the makeup of what makes our region tick. But I really wanted to talk about jobs with Terry. Terry and her group do a lot of workforce, a lot of research that feeds into workforce development, then working with the different economic development agencies, working with the universities and the colleges, working with the high schools to try to better match the needs of the businesses that are out there and the entities that are out there that are hiring with the skill sets that we're building in our young people here in Lackawanna County, Luzerne County, and the whole NEPA region. Terry also happens to come on a day where we got some jobs numbers at the national level that are pretty tough to swallow as well. 14.7% unemployment nationally. That's a stat that no one thought we would just kind of suddenly see over the course of 2 months here in 2020 on the heels of what was an economic boom. And so it's tough to make sense of it. So we have Terry to help us do that. Let me invite Terry on here and just make sure that Terry, you can hear me?
Yes, I can see you too.
Oh, well, excellent. Hello. Okay, let me just quickly, I think I lost my, sorry, a lot of moving pieces here. Got a special book that's just the right size for my Chromebook. Okay, there we go. So there's Terry. Are you guys okay can you hear on the live feed? Can you hear Terry? Terry, can you just...
Hello, everyone.
Let me just check. Sorry, we're...
Yes, we can hear you both.
Okay, great. So, Ms. Terry, and actually, Megan, could you cut and paste, please, the Institute's the quarterly tracker into the Facebook so that people can click on that and see the type of work that Terry and her group do. So, Terry, if you could, we start with trying to help us make sense of what the news from this morning. So unemployment, the jobs numbers come in, what are the jobs numbers, and then 14.7 unemployment. Help us make sense of that. And then how does that kind of relate to us here in Northeastern Pennsylvania?
Well, nationally, now with an unemployment rate at about 14.7%, it's almost a 10% increase of where we were pre-COVID. I think we have to consider the fact that even as a region, we were fairly strong going into COVID, just like the country was. Not without problems, of course, but fairly strong. And so that is a good sign. This is what we would call a forced recession. It was driven by a public health issue, not by challenges in the economy. If we start to look on a more granular level as to what's happening in Northeastern Pennsylvania, there's a couple things. Before the recession, we were doing fairly well. GDP regionally was growing. We were adding people to the labor force, so there was real job creation. And to me, that's more important than looking at monthly changes in the unemployment rate. But we still had some issues because we have about a quarter of our residents in the region that are households earning less than $25,000 a year. And that's problematic because it's very difficult to provide for your basic necessities on those kinds of household wages. So we had some problems, and we've noticed over the years that regionally we were following a national trend where some of our middle class folks were becoming more on the verge of poverty. So we were seeing a little hollowing out of the middle class and having more haves and have-nots. Now that being said, here we are in COVID, and there's a lot of additional challenges. In Lackawanna County, about 58 to 62% of our businesses are considered essential, which is a fairly strong number compared to other regions across the country. Nonetheless, even as essential businesses, business may be down, there may be some layoffs, there may be some furloughs. And if we look at the unemployment, we've got a couple challenges. One, we've only got numbers through the end of March in determining a rate, and that was about 6.5% in Lackawanna County. There is no distinction between layoffs and furloughs in terms of unemployment. The furloughed folks are definitely being invited back as the economy moves to more reopening. But if we look at unemployment claims by weekly, initial claims filed actually reached its peak on April 4th, and we've started to see a decline in initial claims. Specifically from the week of April 18th through the 25th, there was a 25% decline in initial claims. Now, if we look at continuing claims, they hit their peak the week of April 18th, but from there through the week of April 25th, there was a 15% decline. So we're starting to see some gradual improvement. In studying the job postings for our region, if we look at jobs that were available from April 6th to May 6th, there were over 5,170 jobs in Lackawanna County, covering 432 occupations for a variety of different employers. So there are things like actually looking for retail salespeople and drivers, human services workers, social services workers, big recruitment effort going on for nurses, truck drivers. So we're starting to see now some differences in the types of jobs that are available and new types of jobs opening up. Groups like Instacart and Rosie and services like that are doing home delivery of groceries. Grubhub and DoorDash, a home delivery of takeout, are scrambling for workers. The big warehouse and distribution and e-commerce sites like Walmart and Amazon and Target are looking for employees. So there is some opportunity. We expect to see some continued opportunity for jobs. The news is not all negative. Under a best case scenario, we will start to see some modest growth in the third quarter of our calendar year and even more in the fourth quarter. But frankly, we're looking at least another year before we reach pre-COVID levels of employment and economic prosperity. So there are some challenges ahead, but the news is not all that bad.
Yeah, and that's something I really wanted for us to touch on. And this was before before we got the jobs numbers today. I didn't even think about today being Jobs Day, and that's a little like nerd speak there. That today's Jobs Day, the first Friday of every month. But I think even though those numbers are striking, and that's like, whoa, the economy overall has taken this huge hit, and these jobs numbers don't look good. The unemployment number is high. That doesn't mean that there aren't jobs out there available for residents of Scranton, people in our region.
Yes.
I think that's what's so important to talk with you about. Is sometimes economic data, it can go both ways. It can be, so for example, that the unemployment rate might be 14.7%. But that doesn't mean that there aren't actually a lot of jobs available out there in our area right now. We've had a kind of virtual job fair on our website since day one. And you can speak in a minute maybe to some thoughts you have of where to go to look at some potential job listings. It can go well in that way. And the other side, sometimes I know we hear at the national level, oh, this economic boom, and it's a record numbers, and the stock market is up, and there's all this quote unquote good news at the national level. Well, that doesn't mean that my household or my neighbor's household is doing well. That doesn't mean that overall the city of Scranton is the people in Scranton, their families are doing well.
So sometimes you have to really cut through the data, right, and not take it. You take it seriously, but you realize it's not always, it doesn't always good or bad on its face.
Yeah, it's not one size fits all. I mean, I talk about there being over 5,000 job opportunities in Lackawanna County today, and so that's great for people who are able to work. And it may require some reskilling, upskilling, or changes, but it also doesn't mean that it impacts everybody equally, because there are a lot of people who probably would like to work, but because they have those high risk conditions that could exacerbate COVID, they're afraid to work. And so we have to consider that. And those people, if they're offered their job back, but they're afraid to work because of health conditions, they could potentially lose their unemployment. So it's a balancing act. So while we may have some good news and we may have some bad news, it is affecting every family different. And we have to be cognizant of the fact that even if trends start continuing to move in a very positive direction, it doesn't mean that everybody individually is. And so the data helps tell a story, but you have to put it into context by talking to people about their specific situations.
Right. And with all the work that you do, all the workforce development work that the Institute feeds into, if you're a job seeker right now, where do you think that the best places to look are? If you're somebody that, you don't want to look just like opportunity by opportunity, you want to see a broad range of what might be out there. Maybe you have a family member who is a little bit shy about looking, and you want to help them out. What are some good sources for that?
I think Indeed.com, they also tend to collect job opportunities from individual sites. Monster.com is another site, and they're probably the broadest in spectrum in terms of seeking jobs. But of course, every company, every government has a web page with career opportunities, so they can be more focused. So there are resources out there, but I would start with the Indeed.com website.
And I think something that I've noticed is a bit underutilized in our area is LinkedIn. LinkedIn is, I think, a really tremendous resource with lots of job opportunities and a great way to put the pieces together of, if you can, I've used it before in certain ways, like you think of something you're interested in and you type it in and you start to see who are the people in your area who do what either you want to do as a career, or maybe you're just looking for a way to volunteer. LinkedIn, it links people together by your job, but also beyond your job, your interests and the boards you might sit on, or the volunteer opportunities, or even places that you worked a long time ago. I think maybe you're a veteran and you want to find other veterans in the area and start you want to start some sort of philanthropic entity with them. LinkedIn really takes people's resumes, and you really can pull from that and find a lot of interesting people that are right here in northeastern Pennsylvania. So LinkedIn, I think, is a really good source, and I think a lot of people that I know that could really benefit from it maybe haven't started an account yet. So that's certainly something that I would also suggest for people. City of Scranton, of course, we are. We've got some job postings up. We are still looking for a treasurer, which is an exciting position here, especially for somebody who really likes to crunch data, likes to crunch numbers. So I really appreciate that. So Terry, I also wanted to touch on, I know this is a much longer conversation and we don't have a lot of time, but just broadly, when you think of the way that kind of the future of jobs in northeastern Pennsylvania, what are the industries that come to mind? What are the jobs that are going to be coming online in the coming years? And if maybe you're a person who's looking to pivot from one industry, one career to another, or a young person, starting out for the first time, what are those industries that are really going to have lots of jobs available as we go into the future?
Well, I think there's incredible opportunity in the region once we see some economic recovery from COVID, because what we were looking at pre-COVID was what I was calling a workforce shortage that was going to last a couple decades. I don't think it's a surprise that the population in northeastern Pennsylvania is slightly over. There's a large amount of baby boomers currently in their 50s and 60s, followed by groups in their 40s that are going to be retiring over the next 10, 20, 30 years and leaving incredible vacancies. And the reason why it's a challenge is because when you look at that younger generation, it's actually smaller in number. So our population is like a funnel with the oldest segment at the top and the younger population going down the funnel are just smaller in number, sheer numbers. So before this all hit, really, there were incredible opportunities starting to unfold in a variety of industries like healthcare, like information technology, finance, insurance. The trades are huge. If anybody needed a plumber recently, like we did, we had to wait until they were ready for us. And then the labor charges are about $100 an hour. So the trades are always have been underestimated as career opportunities that provide family sustaining wages. And we have a gap in those now, and it's going to continue. So there are other opportunities. And certainly with the whole COVID issue, a lot of people are telecommuting, and they may continue to telecommute. So careers in computers and information technology are really big. Also, individuals have gotten a taste of what it's like to have curbside pickup and grocery deliveries and other household items delivered to their home. And that's going to mean that a number of retailers and e-commerce sites are going to have job opportunities both within the facilities and within the transportation sectors. So I think we'll see some of that in the future continue to grow.
Yep. Yeah, I could talk to you all day about the future of work, because I think it's fascinating. And if we are trying to make, see the good and the optimism and the silver linings here, I think we've accelerated on some of the future of work pieces. And there are more opportunities for people to have careers where they can balance family and they can balance other things with their work by working from home. And I think that's a really good thing. And to your point about healthcare, as we already have a shortage of nurses and healthcare workers, home health aides in the country, we certainly are looking down a path of having a shortage of them in the future, and in northeastern Pennsylvania specific, because we do have a bit of an older population. So that is a career that really needs people. It really needs people that care and are dedicated. And I have always wanted to see those wages go up in that industry. And I think that it's more clear than ever that needs to happen. So I'm hopeful that we'll start paying our healthcare workers more, and that hopefully people can go into that and make those careers out of that and be able to make enough to sustain their families and really prosper. So I'm hopeful that there are silver linings in all of this.
Well, the one thing is you're right about wages. Wages in a number of sectors need to go up. I had mentioned before about the 25% of the households in Lackawanna County that earn less than $25,000 a year. And that's not sustainable for families with children, even married couples, just to cover basic expenses. What we were noticing before COVID hit is because of that labor shortage I talked about, it was putting some upward pressure on wages. And so that was a very good sign. And I think we'll continue to see that, not only because of the labor shortage, but because people may still be afraid to go to work, and wages are going to have to go up to entice people to do that. I would also stress that before COVID, we were starting to see some elements of automation. You saw self-checkouts in grocery stores, less individuals in some fast food restaurants as things were becoming more automated. And so those jobs were going to go away slowly over time, and maybe accelerated due to COVID. Right. But I think what people need to remember is if you're a high school graduate with no type of apprenticeship, certificate, credentialing, higher education degree, jobs are going to be tougher. They are not necessarily all family sustaining. So I just encourage people to take advantage of whatever education and training opportunities they can, because the people with the least amount of skills are going to be negatively affected the most economically. And so it's not always a 4-year degree for everybody. There are all sorts of certificate programs and credentialing and even 2-year degrees.
Yeah.
So you need to plan ahead.
Yep. I think that's a good place to end, and we'll want to speak to you again and speak to certainly some of our local colleges, universities that that offer those types of programs. Lackawanna College, Johnson College, right here in Scranton. They offer excellent educations, certificates, and 2-year and 4-year degrees for people. So certainly agree with you. Not everyone should go get a 4-year degree. They're expensive and they're wonderful, but especially at a time when a lot of households are hurting, it's hard to think through 4-year college right now as the solution for everyone. So like you said, it's not one size fits all, and we'll continue to use your work, Terry, and work with you to find these solutions for us here in Scranton, and we deeply appreciate you. Thank you for spending your Friday with us.
Well, thank you for asking. It's been a pleasure, and I applaud all the work that you're doing in Scranton. I think there is great potential for the city.
I do too. All right. Thanks, Terry.
Thank you.
Okay. That was improvisation. I don't know how that worked. Terry, I don't know if you could see, but I had you up on the screen. I held the screen on Facebook. Oh, man. Okay. Thank you, Terry. So the studies that Terry and her team do, I know Andrew and her team is tremendous. They really do a great job of looking at the past to inform the future and help us in Scranton. So that last piece about education is really key. And I know I don't mean to be, I hope it doesn't seem off topic, but I know how much people are hurting. And I also know that there's a lot of young people out there that are coming off of, maybe high school or college or a 2-year degree or a certificate program or what have you. And maybe the job they thought they were coming into is on hold, or they were in the job market and they were hopeful, and then bam, that job market is cut. So when I actually graduated from college, it was the year of 9/11, and the same, well, not as drastic, but certainly my senior year, a lot of my friends, some of them thought that they had jobs, and then those jobs were no longer available because the businesses that were going to hire them after graduation were no longer doing that. So it's really hard if you're coming into that type of situation. So we do have great, like I said, Johnson College, Lackawanna College, the University of Scranton, Marywood, all right here in Scranton. We have Keystone College just up the way. And of course, Wilkes-Barre as well. We have so many, I think there are 14 colleges and universities in our area, and they offer, you really could get trained up on nearly anything by going to one of these institutions. And I've had the pleasure of getting to know most of the leaders of those institutions, and I know they want to have those conversations with people to figure out how we can make this new job market work. So always important to think about the future, even though we're still right now in a tough time. So wanted to just I'm going to pull up the jobs numbers. The COVID numbers. Those come in, as you guys know, right as we're doing these. So let me just check in and see what we've got here. Okay, it looks like one death overnight, and for let's see, 21 new cases in the county. So we're trying to make sense of the numbers. I know we continue. I personally, my team, us at the city, we don't have all the data we want. We couldn't tell you exactly how many of the COVID deaths in Lackawanna County are in Scranton. We can go by zip code, but some of those zip codes overlapped, and we don't have enough granular data ourselves to be able to tell you exactly what that looks like. We're trying to get the sourcing on some of the information that's out there so that we can be much more specific in letting you know. It does appear that a large percentage, maybe more than 75% of the deaths are related to nursing homes, long-term care facilities. That's what it appears. I don't have that data certain. We are trying very hard to get that
that ironclad to be able to specifically report that. But we know that the numbers are high in the deaths related to nursing homes and long-term care facilities. We continue at the city to try to help out the nursing homes and get them extra PPE. I know the Department of Health also is working hard to help out those nursing homes and long-term care facilities. The hospitals, of course, themselves also. It really is a team effort. And the case numbers, the case numbers are lower than we had once feared, but the people are still getting it. People are still dying, and that's why we're still in that red phase, and that's why we're facing this continuation until June 4th. So it's hard news, and I don't want to sugarcoat this stuff, right? This is really hard news to hear, and it's a long road we're all on. I think try to just keep it in perspective that we're actually not even 2 months in, which is to say in the large scheme, in the grand scope, the days are so long, but it's not been that much time, and we can do this again. We can do this for another month. We can definitely do this for another month. We absolutely can. We've done it for 2 months. We can do it for another month. We can do it for a little bit longer than that if we have to. It's better to really keep doing what we're doing now, and instead of having to put that lid back on. So, oh man, it is hard though. It really is, and I think we're all going through this on a personal and emotional level too. That June 4th is tough, but we got to do it. I am thankful to the governor for baking in some certainty for us. The more information we have, the more we can do to be proactive, to help our families, help our households, help our businesses, help each other. So not great, but June 4th, now we can go forth and make some plans. We continue to try to find solutions for small businesses. There is still $140 billion in the PPP program. And if you are a small business or you know somebody who is and you don't think that they've applied, remember, you can be a Schedule C, a sole proprietorship. You can apply for that PPP. It's the Payroll Protection Act, and it's the Payroll Protection Act, so it's about payroll. However, you can also get rent and utilities covered. So it really is worth applying. $140 billion still in that program. If you need help applying, you can contact the Small Business Development Center, the NEPA Alliance, Scranton Tomorrow, and the Scranton Chamber of Commerce can all help you out with that. Or, of course, your bank, your lender, can get you some information and help you get that application in. So know that that's still there. However, I know it's not a silver bullet if you're a small business, and we're trying to find some ways here in the city in partnership with those institutions I just mentioned and the banks to figure out if there's some local solutions we can come up with. In addition to that, there are things that we're looking at from the city for ways that we can have some fun this summer, even while we're socially distancing, and enable our businesses to open and thrive in some way, even though we're definitely gonna need to be socially distancing. So it's a lot to try to absorb, to think that a restaurant would reopen with 25% seating capacity. They're not going to be able to make their numbers on that. So we need to, along with that federal aid, we need to think through creative solutions on the financial side, and then also on the policy side at the city. What can we do to help these businesses literally expand out, maybe into the sidewalks and things like that. So we're putting that package together, and any ideas are welcome. I always say that this is a forum for ideas. I am a little behind on the comments, so I'm not going to be able to catch everybody's comments today. But Megan will catch some of them, but also send to Scranton 311. Send your ideas if you have thoughts of ways that we can help, things that you've seen in other cities. If you see a cool story from across the country or in Europe or in Singapore of ways that restaurants have been able to open with that expansion and that social distance, please, let us know. This is why we're all doing this. All right, let's see. I'm gonna check here. Okay, and for I know we're frustrated about the June 4th piece, but another thing to keep in mind is Lackawanna County still has the third highest per capita death rate in the country, in the state, excuse me. So today it's Delaware County, Montgomery County, Lackawanna County, Bucks, Philadelphia. Sometimes we're number one. Most of the time we're number 3 or 4 or 5. It's important to keep that in mind as it does feel long, and it does feel really frustrating that we really are still up there, number 3rd in the per capita death rate. It's at we're at 5.36 deaths per 10,000 people, and that's higher than we're seeing in the rest of the state. Let me just pull up. So I'm gonna be really excited when I can do these from a desktop at an office. It's going to be great. Okay. Rite Aid had a very cool announcement yesterday. So Rite Aid is now doing no symptoms testing. Megan will put that on the Facebook page so that you know where that is. So that's a really exciting development, and thank you to Rite Aid. Rite Aid started in Scranton. So as we all know, all roads lead to Scranton. It's a Scranton business. If you go downtown, that Rite Aid on the corner of Spruce and Washington, there's a plaque that says that. So Rite Aid's doing a great job of getting that testing ramped up. And again, very exciting news that you can do no symptoms testing. Don't just go to your local Rite Aid. It's not at every single Rite Aid. So Megan will post that so you can see what those locations are. In addition to that, of course, we're in the bigger testing. It's still, you've got to have the symptoms, but call 877-PA Health or Geisinger 284-3657. That the hospitals, they'll make an appointment with you to do the testing there, or with Department of Health, you can go to Mohegan Sun in Luzerne. Part of the larger task force we've been putting together here, again, state legislators, the commissioners, the city. Part of that is to figure out how we can get more. I mean, we've been talking about this, but again, formalizing that communication. How do we get more testing and more tracing up here more quickly? I know Department of Health is really working hard on it. We just want to make sure that we're really all hands on deck to be able to make sure that we're getting as many resources as we can. So I'm optimistic that more testing will be coming on online soon. As we know, the more tests we have, the more data we have, the quicker we can reopen some of these things and get people back to work. Okay. So the county extended their emergency declaration through June 8th. Now we know the governor's extended the stay-at-home order through June 4th. We've been trying to watch the governor in the county, so I'm sure currently the city's emergency declaration goes through May 15th, but we'll extend that at least to where the governor is. And the governor also signed an executive order yesterday to suspend foreclosures and evictions until July 10th. So you can't get evicted until July 10th. Rent and mortgage payments are still due, but you cannot be evicted. And so that's an important thing for all you to know out there. And then remember, guys, the masks are still mandatory. I know I do see a lot of comments. People aren't wearing masks, and we've got to. This is part of this task force, is how we deal with this. The masks are here to stay for quite some time, so we do have to figure that out. The 348-4101, we can try to match you up with a mask. Anyone on the comment section, if you know of a place to get masks. I think more and more they're becoming available, which is great, and some of those retail outlets are selling them. Unemployment remains a challenge. It's very challenging, and I know that. As soon as we have more information, we will let you know, but in the meantime, try to keep these things in mind. So the PUA, the Pandemic Unemployment Assistance, is fully operational now. You can go to uc.pa.gov. And again, you can file back to January 27th. Once you get that in and you're approved, that first payment should come in within a week. Okay. And then the regular unemployment compensation still uc.pa.gov. If it's been more than 3 weeks and you've still not received your PIN, request a new PIN. Try not to be requesting them on a daily, weekly basis because that contributes to the backlog. And again, once approved, you'll receive the back pay for the weeks you were unable to file. I know this isn't perfect. It's hard I know you need the money now to pay your bills, but that money will be coming to you. So again, as soon as we have more information, we'll let you know. In the meantime, there's a virtual assistant for unemployment, 877-978-1295. There's a live chat, 888-313-7284, or uchelp@pa.gov. And on our food, the food piece and the social services piece. So we raised $180,000 through the Heart of Scranton fundraiser. So appreciative of all of the funders and all of you out there who contributed $5 to $500. It's just tremendous to see that type of support come through. So $180,000 that went to the Weinberg Food Bank, Meals on Wheels, and Friends of the Poor. It's just a tremendous show of force of our community that we're helping keep food on each other's tables. And it just blows my mind how generous people are. And that was Scranton Area Foundation was our partner on that. Moses Taylor Foundation, Geisinger Foundation, Manuka Subaru, and the Weinberg Foundation that did those matching funds. That was just a really good thing that I think lifted some spirits and is going to get some food to these food drives. So as we talk about these food drives, food giveaways every week or every few days, that money is directly contributing to the food that they're giving. So with that, Friends of the Poor's next drive-through food giveaway is Wednesday, May 13th from 2:30 to 5:30. It's at the Career Technology Center, the CTC. That's up at 3201 Rockwell Avenue here in Scranton. So again, next Wednesday the 13th, 2:30 to 5:30 at CTC, 3201 Rockwell Ave in Scranton. So very appreciative to Sister Ann Walsh and her team, Linda and Megan as well, for always doing so much for our community with that. Food pantries remain open at Jackson and Valley View Monday through Friday 9 to 12. Keystone Mission 1 to 4 p.m. Monday, Wednesday, Friday at 8 West Olive Street. Salvation Army, call them 344-9878 to get something delivered or to volunteer. And we're continuing to push for SNAP benefits to be able to be used online. That's an effort that Senator Case is really pushing hard on. So we've got a few new volunteer opportunities. NeighborWorks NEPA is challenging you to get creative, spread some smiles, and show kindness while practicing safe social distancing. Residents are asked to document acts of kindness through a photo or video for a chance to win fun prizes, including a Weber grill, Yeti cooler, and speakers. So that's cool. Go to, so right here on Facebook, NWNEPA, so NeighborWorks Northeast Pennsylvania, NWNEPA on Facebook to submit your entry. It's pretty awesome. And this one's really cool. Serving seniors. So we talked about here how can we help the nursing homes? Can we send cards? Is there a way to brighten the days of our folks that are cooped up in the nursing homes and not able to see their family? So Serving Seniors is starting Operation Reach Out. They're looking for volunteers of all ages to support the project by submitting letters, cards, and drawings. So children's drawings, I think, are especially wonderful for folks to get. You can send in a document. So letters can be written in a Word document and sent by email to servsen@epics.net, so SERVSEN @epics.net. If you want to send a handwritten letter card or drawing, please call 344-3931, and they will let you know how to get that there. Please don't send the cards directly to the facilities. This is what we wanted to be able to say, oh, go for it, but we want to have a process here so we're not just bombarding the nursing homes with these cards. So they're not going to mail the cards directly to please don't mail them directly to facilities. Serving Seniors will take steps to quarantine the items prior to delivering to the facilities. So they'll take those steps, and that'll be really helpful. So Serving Seniors, Operation Reach Out, I think that's so cool. Megan will post the info there on the on the ticker, and we'll post it again. I know we already posted it. We'll post it again on Facebook and on our website. So continue to check in with your neighbors. Everybody needs each other right now, and check in, make sure people are doing okay, especially as we, looking at another month of the stay-at-home order. So please do that. All right, questions of the day. This is the fun part, right? This is what I look forward to. And again, I'm not caught up on the comments today. So hopefully some of those questions, if they don't get answered by the community or by my team, we can try to answer them offline. Oh, okay, so Larry has a good point that is really, really relevant as we talk about how are we going to be able to save lives, but also move forward. Larry says, please suggest that the Department of Health count COVID cases and deaths in nursing homes separately from those that are not in nursing homes. Those deaths are in a confined area and not in the public area where people are walking around. So the Department of Health, it lists the cases associated with nursing homes and personal care homes on their website by county. They don't show it by facility. That data would really be helpful. So we know it by county. We don't know it for Scranton. We don't know it by facility. There is a big push by a lot of us in seats like mine, let's say legislators, to get that data to be public. Not because we're not to single any nursing home out, just kind of to this point, we need to know where the hot spots are in order to really make the sound decisions going forward. So Larry, I hear you, and it is tough. We've asked for that. I know there's a lot of legal red tape that has to go into all these decisions. Department of Health has the hardest job of anyone, aside from our frontline healthcare workers right now. So that's important to understand. But I agree with you. We need more data. We've been saying that for a long time, and we continue to try to advocate in a respectful way for that. Glenda is asking, do hospitals send patients over 65 home? Let's see, it says, I have an answer here that, so it says, patients who are positive for COVID-19, who are able to recover at home are, I think the hospitals encourage people that can recover at home, so they're not taking up the hospital beds. But I'm not aware of anything that's specific to over 65. I haven't heard anything like that. I think that, I'm not sure where that's coming from, but that's certainly nothing that I've seen or heard from our hospitals. It's not about age, it's about symptoms. If you have the symptoms that require hospitalization, those beds are there for you. Like we've talked about, the hospitals have remained under capacity. That's because we have been under the stay-at-home order. So we've been able to stay under capacity, and there are beds open for that reason. So that's why we have to keep doing what we're doing. Chris asks, PUA, so the Pandemic Unemployment Assistance, applicants who filed weekly claims got an error. How long will it take to fix this? Okay, I didn't know about that. It does seem that they've done some tweaking to it this week. So try uc.pa.gov again for that PUA guide. And again, we'll continue to try to get some information as it comes online. We're kind of hearing the same thing too. And I hope and think that they're hiring some new additional folks to deal with this volume. I think they're doing that. So, but yeah, Chris, I'm not sure if you want to send in a screenshot maybe from the Scranton 311 email, that could be helpful in being very specific as we take questions to the Department of Health. We got a fun one this week from, this says anonymous, but can we have pet ducks in the city? So I didn't know the answer to this question. My alma mater is the University of Oregon, so I consider myself a duck. The University of Oregon duck is our mascot. Donald Duck is actually the mascot for the University of Oregon. I was born at the hospital on campus in Eugene, Oregon, so I will always truly be a duck. So anyway, I loved this question. The answer is that yes, if you have a property that is large enough, you can have 2 ducks. So in the city of Scranton, you may have 2 ducks. Do need to check in with us though, please, about your property. We don't really don't have ducks in your apartment complex. It's really if you have some square footage out there in the yard that you can let the ducks run free, but you can have ducks here. So it's very exciting. I always learn something new from all of you guys. We hadn't had the duck conversation yet. I talked with the team in licensing inspections. We talked about dogs, we talked about cats, we talked about bees, we've talked about chickens. Had not talked about ducks. So thanks for that question. We all learned something today. Let me check my phone. Sorry, I'm so far behind on the comments. It's hard for me to scroll through too quickly. Okay. Oh, I did. Okay, cool question from Craig. So that's when I talked about kind of looking through a package of policies that the city could put together to help us open and be able to be social and be able to be quote unquote together again as a city and as a community. Really, we're continuing to look at, and this was already in process, but we're looking at more bike lanes, like you say, a more social and more walkable downtown. I think that some of the things that we could do to help our businesses open and expand this summer could really help us accelerate some of those efforts. You mentioned Seattle planning to do public space overhauls. That's the type of thing I'd love to see if we could figure that out, something that could be really transformative for the way that we engage with each other downtown. So we're looking at that. Please feel free to send ideas that you have. Again, Scranton311 at scrantonpa.gov is a great way to do that. So I love that idea, and we have such a cool downtown. The buildings are so beautiful. It's a great place, and I'd love personally to have more places to eat outside. For example, I know you go to some of these bigger cities. I spent a lot of time living in Washington, D.C., for example, and there are tons of restaurants with outdoor seating, and you go and have brunch and enjoy your weekend outside during those summer months. So I'd love to see more of that, and we're trying at the city to try to see if we can enable that. So more to come on that. Stay tuned, but ideas are welcome. Like I always say, this is a community conversation. We want your ideas. It's hard for us to stay on top of everything, and we don't have all the answers. So please let us know your ideas. Let me try to go through some of these. Okay, got it. So Rite Aid, the closest stores to get testing are Plains Township and East Stroudsburg. That doesn't help us out too much up here, but I will keep checking in on that for you guys for Rite Aid. Let's see. Tamara says with PUA, if you make a mistake, you can't reach anyone. The phone line isn't working. Okay, so there are a couple of other phone lines that we can repost, and that I think there was an email, and we'll try to, again, I know it's frustrating. I honestly can't imagine how frustrating this would be. So I feel you. If the phone line's not working, Tamara, uchelp@pa.gov would be one way, and we'll hope to get some more information on this. I think they've kind of had some time, hopefully, to get some of these things up and running better. So let's hope that that'll work. Okay. Tom is asking a question about the testing. That I think, Tom, that's not a question I can answer, but probably a county coroner question. Let's see. Maybe we can get some answers on that front and bring those back. Tom, if you have a more specific question, Scranton311 email would be a great way to answer that, and then we can maybe forward that to the coroner and see if we can get an answer there. So furniture stores, believe those are still closed, and I know that's really ordering furniture online. That's a tough one. I don't want to order furniture online, so I know that those stores, that would be nice if those opened. But we're not there yet. But that's another example, and I would say So Tracy asked that question. Tracy, if you have a specific thought on the furniture stores, shoot them into the email. We'll include them in what we asked the governor's office about. Just those examples, those specific examples really help. So just kind of this broad reopen everything doesn't really help. It really helps to have a specific example of why a certain thing should open. I see Larry, you have a question about city pools. We not too optimistic on that front. We'll have more very soon for you on that, but not looking good for being able to open those. So we are going to work hard to think of other ways that we can safely have activities for our kids at our parks this summer, but not looking good on the pool front, unfortunately, especially now. Again, now that we know June 4th, we're still stay at home until then. You know, it's really, I think, impossible for us to be able to to open for the summer, which is a real bummer. But again, try to look at the bright side. It gives us time to make some repairs this summer that maybe we wouldn't have been able to do. So we're trying to find silver linings in all of this. Debbie is asking about hair salons. Lackawanna County is still in the red phase, so hair salons are not able to open. That's the hair salons opening on the 8th. Today's the 8th, I think. That's in the yellow counties. That's Lycoming County and in West. And that's why I know it's confusing, because some of our media market, like if you watch the nightly news, the media market expands to yellow phase and red phase as a region. And so if you watch it, it is confusing to know. So that's another reason we're here trying to say specific to Scranton, red phase, unfortunate, but we got to keep doing it. No hair salons. I need a haircut, guys, real bad. I'm sure all of you do too. So it's unfortunate that we have to keep doing this, but we got to do it. We just got to do it. Let's see. Let's see. Okay, Anne Marie's asking about the eye care. It's a good question. I don't actually have the I don't know in terms of eye care what that answer is. So maybe we could get some more information. Megan, if you can note that, that would be a good one to be able to talk about. Okay, so we've hit 1:03. I'm sorry we were a few minutes late today. Again, we're still trying to make it fancy here, and we're making it work as best we can. Let me just do, there was one more thing that I saw on here. Yeah, so I guess I would just end on that. We're all impacted by this in similar ways. I think every household is impacted negatively in some way, some much more than others. If your household is experiencing a really urgent situation, in order to press pause on some of those payments, in order to press pause or go get services. So 211 is a good resource for that. Also, just email or call us and we can try to set you up with the right resource. So call 348-4101. My team will answer and we'll do our best to direct you to services. And that's Scranton 311 at scrantonpa.gov. Same thing. If there's no shame in raising your hand for help, this is all hands on deck. Everyone is impacted in some way. Every household. I don't, income level, like any income level, everybody's tightening their belts in some way. So please don't be shy about raising your hand. If we can help you, we will get you to any resources. And the city we want, and it's our job to be at the hub of this community and help you connect and help. So on the small business front too, like I said, we're working really hard to find some solutions there, and we need your ideas of how we can help get back to being able to go out, go to restaurants, go to dinner with, and maybe it'll be waving high for the foreseeable future. But I sure would like to be outside having a beer. I think I can say that. I think that's okay to say, right? Really looking forward to getting back to that, but it's going to take a lot of hard work. It's a lot of flexibility. a lot of wet mask wearing when we're outside of our own homes. So let's try to think positive and think constructively and productively about what we can do. We'll continue to get information to you. So our number is 348-4101. Anything from my business is really struggling, what can I do, to I need a mask, can you help me find a mask? Anything. Let us know. We're here for you. And I appreciate you all very much. Happy Mother's Day to all of you out there that are mothers. This is my first Mother's Day, which is really exciting. Would love to be having brunch somewhere. We'll be having brunch here. So we'll be thinking about all the wonderful mothers out there in Scranton who make our households tick, make this world tick. And thank you all for tuning in and doing what you're doing to help each other stay healthy and help save lives, because we really still are in the middle of this. So thank you and have a good weekend.